Hi, I thought I'd give you guys a tour of my OR as well as describe the surgery to you in a way that I would do if I were in a consult with you, because I know people are asking me lots of questions and a lot of people are super shocked that this particular procedure can save so many women from tummy tucks. So I'll get into why that is in this procedure or in this particular live video right now. Hi, thanks for watching, guys. Okay, so I'm in the operating room and I'm going to pretend like you are my surgical patient or potential surgical patient, and I'm going to tell you about this machine. And usually what I do is I walk in and I give them a couple of my instruments and show them that the sharpest things I have in my repertoire are these two things. This is a 3mm punch biopsy. So if you put that up against my skin, you'll see it's tiny. Tiny, 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 right? And I do have a surgical scar from my liposuction, so maybe you could get an idea of what mine looks like. Yeah, see that little brown spot thing? That's about as big as it'll be. Okay, so you walk in, you're a patient, you just took your medicine, some Valium and some pain medicine and a nausea medicine. Great. Now you get in your, oh, we got to show them that. We kind of make it spa-like around here, right? So we usually have the patient room, which is our prep room. This is where we take photographs of everything right before they go into the operating room. Then we have them get all nice and comfy. Hold on. Okay. We have them get all nice and comfy in the robe, right? So I'm the high patient. I'm walking to the OR from the prep room. Here we go. Coming in. Hi, Dr. Gregory. Thanks. We're going to do surgery today. Usually I have my music going. By the way, this is my new nitrous machine, and I plan on using it for those patients who feel that they need a touch more sedation than the oral medicine. A little bit of nitrous might work. Okay. So now we're on the operating table and we're gonna get started, right? Okay, so either Selena or Lily, one of my operating room techs, will come and they'll take betadine and then they will smear it up and down the abdomen, right? And then it's time for me to make my holes. So I'm laying on my tools. So what would happen next is I would take this needle filled with lidocaine and I would inject that into ports into the abdomen. The most common areas for abdominal holes, and by the way, I've found a new way to do this, are right under the breast or chest wall for men. I do 2 holes there. Then I do 2 holes right near the belly button, on either side of the belly button, but towards the edges, which now I use a small blade rather than a circular hole. Way better cosmetically. And then the last 2 holes in the front will be right in what we call the mons pubis, which is basically where your hair grows in the pubic area, in an area that obviously won't be seen. So those are the 6 little holes that will be created. And then we start with the cannula and the wand. Here is my beautiful wand. Remember, this is the only kind of machine that will not rip, cut, tear, heat, or freeze tissue when you do liposuction, so that's amazing. You'll see the force of my hand will be mostly like this. It will not require any rapid, well, it does rapid, but it won't require any forceful movement like that, like you would see in a classic lipo case. That does not happen here. Now I'm gonna open my sterile cannulas so you can see the ones I use here. Here are my sterile cannulas. These are autoclaves, so basically we just take them and rip them open for surgery. I'm not doing surgery today, so you don't worry, guys. Me touching these is not an issue. We will re-autoclave these, okay? So here's my repertoire. I have a lot of types of cannulas, but the ones I want you to pay most attention to is this one. No, this is not Vaser. Thanks for asking. This is actually why I'm talking about this machine. This is called a Fun Sculpting or Vibrosat machine. Here you go. Vaser is a laser technology liposuction that will burn subcutaneous tissue underneath, which is not a desire. I don't want to burn, rip, cut, tear tissue underneath. That decreases your fat transfer retention rate. It also damages subcutaneous tissue underneath, which also increases length of time of healing. So I'm not interested in any kind of fancy lasers that burn your tissue. This is vibrate only. The nerves will feel one of two things, vibration or pain. So once you have a vibrating machine, you actually have analgesia with that. So back to the cannulas. Cannulas here. This is the, see, my hand is really small. So obviously the cannula is tiny. This is what I go in to numb the patient with. About hour to an hour and a half, no problem, to numb the patient. Basically, once you make the holes, you just go in and squirt. Like, think about if you were in a dentist office and they were just kind of numbing inside your jaw for a procedure. Same thing. I'm just going in with this tiny little wand and I'm squirting a ton of lidocaine with saline in. I usually use on average of 4 or 5 liters of saline to get in. Once the patient has been completely tumesced, imagine this. Inside their abdomen, there's the skin on top. There's the fat with connective tissue in the middle. Now it's all swimming inside saline. And then there's the muscle on the bottom. I don't go under the muscle. I don't go anywhere near your organs. I can't. It's not even possible with the blunt tools I have. People ask me that. Okay, so now I'm in this space where there's fat and connective tissue. Think of the connective tissue like a forest or like Swiss cheese. I will not rip, cut, or tear through it. All I'm doing is migrating or navigating my way in between the connective tissue, using the vibration to find my way through. And so it does not damage that tissue. That's why skin sagging is a minimal risk, and that's why I can save so many women from tummy tucks. So you'll see that, okay? So then once you numb the patient, you go back with the suction cannula. Look, not sharp. There's nothing sharp here. The suction cannula, the only difference between the infiltration and the suction cannula is the hole right here. This is called a Mercedes. This Mercedes suction cannula will take the fat undamaged. So if you look at people using classic lipo, their fat retention rate is about 30%. Why? Because they're jamming that rod inside. It's like a vacuum on a stick. They're jamming it inside the body. You see the entire body shaking and jiggling. I think it's really rough to watch, to be honest. And then they take out all these fat cells, but a lot of them are ruptured, a lot of them are destroyed, a lot of them are mixed in with connective tissue. So what happens? Then they have to go through some purifying technique and then transfer that back into the patient. By the time it ends up in the patient, the body recognizes many of those fat cells as foreign because they're mixed in with so many other cells that there's only a 20 to 30% retention. Ours, I don't move my fat, I don't purify my fat, I don't have to. I literally, I pull it right out of the body, undamaged, and it stays in my glass canister. Where is that canister? It stays untraumatized, and I transfer it right back to the patient without having to purify a thing because it's already pure. I'm sorry, I can't find it, but I'll show it to you on one of my fat transfer surgeries. So now we're going through the procedure, right? So we're going through, and I'm using this particular wand, and I'm doing great. Thank you for asking, Miss Coleman. So you go in and you do the procedure, in and out, but you'll see on a lot of my surgery videos that my hand is really like this. I love how I'm still wearing my robe. Okay, like this. That's my hand movement, guys. That's my hand movement, okay? That's as rough as it gets, right? And then this is my favorite part. My favorite part is when you get to the end and then you get them to, oh, back and forth. Yes, back and forth. None of that rough movement. It's gentle, gentle. I don't have to. It's because of the vibration. It's so exciting. To give you an example, I did one surgery where my wand or my vibration stopped vibrating and I couldn't even push. Like it like almost was stopped. And then I realized what it would have taken if I was a classic liposuction surgeon for me to get through. And it terrified me because I thought, how do they not like rip holes in people? And it also made me wonder, what was it like for me when I was under general anesthesia, not knowing what was being done to my body? I know a lot of people have that fear too about the general anesthesia. You don't have to worry about that here. There's no general anesthesia necessary for this surgery because it does not cause the same kind of tissue trauma. Isn't that amazing? So no, you can pop a couple of, well, I've given Xanax too, to be honest, because it's shorter acting. So yeah, you can pop a couple Xannies, obviously under my supervision, with the medication, the pain medication, the nausea medication, and we'll go right through this surgery with you together. People might ask me how long it might take to do. I would say, depending on the body areas, anywhere from 4 to 6 hours. Oh, what are the other things? Okay, our post-operative course here. We do a lot after the surgery. Once we're done with the procedure, we get them all cleaned up. You see a lot of my videos with post-op. We sit them down here and we do what's called lymphatic drainage. So that means that the OR techs are taking the patient and they're squeezing out the fluid. Do you guys want to know why I hate cool sculpting? I think holistically speaking, to pay thousands of dollars to trap dead fat cells inside your body and ask your body to rid them of all of the fat, the toxins, the destructed tissue, quote, naturally, like try to rid your body of that naturally. That to me is a horrific concept. Well, I don't want any of that stuff trapped inside me, first of all. Second of all, I've had nurses who've worked in wound care clinics with patients who've had abscesses develop inside because they had a pocket of trapped dead cells in there that just dissolved and turned into a pile of mush and got infected. And then the other reason I don't like cool sculpting is the unpredictability of the results. I don't know about you, but I sure as heck don't want to pay $5,000 for a maybe. Really? I've had people literally come and tell me they spent $5,000 for a full torso cool sculpting and had less than 20% fat reduction. Not okay. If you're going to be paying money for fat to be removed, it should be a 100% yes, I'm going to remove your fat. Not maybe I'll remove your fat, but maybe it'll be some. You can expect 80% of your fat to be removed with this procedure. Cool. Does anybody have any other questions? Because I think I'm going to be kind of wrapping it up here. I just wanted to tell you more about the surgery and what it's like. I'm sure I'm going to be doing this over and over again to teach everybody. Thank you guys. Thank you guys for watching. I appreciate it. Have a wonderful day.